Thank you for joining us tonight. I'm Dr. Susan Sanders. I'm the Vice President for Kaplan Nursing, and I'm really glad you've joined us tonight so that we can talk about next generation NCLEX and perhaps answer some questions and share some new ideas and some of the samples that we've developed with you. So thanks again for being here, and let's get started. So let's talk about next generation NCLEX. And during this session, like all good educators, we've developed our learning objectives. And the first objective to explain why the National Council of State Boards of Nursing started the Next Gen NCLEX project. And I'll probably refer to this as NGN or Next Gen and National Council instead of National Council of State Boards of Nursing every time. And then we're going to also describe how Kaplan's decision tree framework aligns with National Council's clinical judgment model. And then third, we're going to explore the types of questions being piloted through the NGN project. So to start off, let's think about National Council's research. They are presently conducting research projects to determine the ability of current and potential innovative items to assess nursing clinical judgment. In all of the literature and in the discussions, National Council has determined that there's probably better ways to assess a student's clinical judgment than multiple choice questions like we're using now. So they are conducting a research project, and it started in July of 2017, or during that time frame of 2017 when the NCLEX was administered. And since that time, the data that they shared with us last year showing July 2017 to June 2018, they showed that over 190,000 NCLEX-RN candidates participated in the special research section. So after they completed their NCLEX, they were given the opportunity to participate in the Next Gen section of the testing. And believe it or not, 80% of the students agreed to participate. So an 80% participation rate, 190,000 candidates have done that, and that's just in the first year. They have continued to collect data, and we don't know exactly how many to date because those are the figures that they've recently given to us. Now, National Council meets every year and has a business meeting as well as an NCLEX update, and that's usually in August or September. And really anyone can go to those sessions, so we always attend. And at last year's meeting, they announced that if they move forward with Next Gen NCLEX, it would be 2022 or 2023 when they got started. So we have a little time, but it feels like it's moving in fast. And the background information for this research project was based on several different reasons, really. And one of those, of course, is that nurses, all nurses, need to possess sound clinical judgment. And as a result of the changing landscape of healthcare, it seemed that nurses needed to possess even better, improved clinical judgment, and there needed to be a better way to assess that. We've all seen the increasing acuity of our clients over the years, and I've been a nurse a long, long time. So the intensity of care and the acuity of clients just continues to increase. And that's partially related, of course, to the aging population. The boomers are beginning to be retirement age. There's a lot of need for nurses. There's, of course, an impending shortage, and that's very cyclical. So we know that there's going to be a need for more nurses. There's increasing government regulations We have accreditation regulations, we have safety regulations, we have Medicare, all of those things that are put upon healthcare facilities and nurses. And that increases the demand for clinical judgment skills among the entry-level nurses. And also, we've experienced a substantial number of adverse events, and these may have been prevented had there been improved, better, or good clinical judgment. So in the literature that we reviewed, we found that 50% of the errors in healthcare involved novice nurses, and that 65% of those errors are attributed to poor clinical decision making. And if that's not frightening enough, I have a poll for you, and I want you to participate. Julie's moving the poll over, and it's asking what percentage of employers are satisfied with novice nurses' clinical judgment. So if you'll complete that poll just by voting, is it 20%, 30%, 50%, or 70%? So what percentage of employers are satisfied with novice nurses' clinical judgment? And we'll give it a few more seconds, and then Julie will broadcast our results for us. Okay, there's our results. So the majority of you at 45.5% think that it's 30% of employers are satisfied with novice nurses' clinical judgment skills. So Julie, if you'll move the poll, I'll give them the correct answer. It's actually 20%. Only 20% of the employers are satisfied with the clinical decision-making skills of novice nurses. And as educators, that makes us really worried. How can we improve that clinical decision-making? Well, National Council says that clinical judgment is certainly a necessary skill for novice nurses. It can help reduce the errors that can occur. It can assess. A better way of assessing clinical judgment is being developed by the NCLEX, and currently clinical judgment is indirectly tested. So that's some of the reasons why National Council wants to move forward with this clinical judgment model. The clinical judgment definition by the National Council is the observed outcome of critical thinking and decision making, and it is an iterative process that uses nursing knowledge to observe and assess presenting situations, to identify a prioritized client concern, and generate the best possible evidence-based solutions in order to deliver safe client care. Now, we'll talk about a few of those components as we go through. But let me share with you the model and the flow chart of clinical judgment based on National Council. So when we attended the NCLEX meeting last fall, they provided all of the attendees with several slides, several handouts, and they told us that we could use those as long as we attributed them to National Council, and that's what these slides are from. These are straight from their literature, and I'm going to tell you a little bit later on about where to find some of that literature. So with the flow chart of clinical judgment, the student or nurse starts out recognizing cues, and from that they generate a hypothesis, and they then judge that hypothesis, and then they can take action. So instead of intervention, they call it take action, and then evaluate those actions to determine the outcomes. And just like a cycle, you might have to review again, reassess, and recognize cues once again. So with the conceptual model, and nursing process, you think about the recognizing the cues and how that aligns up with the assessment, how they generate the hypothesis by and judge the hypothesis by implementing a plan and then taking action and evaluating. So they have overlaid the nursing process on that conceptual model. And then to make it even more with even more depth and somewhat difficult to read in a full slide like this, so I'm going to break it down for you. It's got actually 4 layers within this clinical judgment process. Layer 0 is the very first, and it starts out with 2 observable entities, client needs and clinical decisions. And this initiates the clinical judgment. Then layer 1 and layer 2 are the cognitive analysis of what's going on in the clinical setting. What are the hypotheses? Do I need to refine those? And then how do I evaluate those? I think the most important part of the model comes in layer 3 and 4. So we'll talk about those a little bit more. The model itself assesses whether the student is making an appropriate clinical judgment based on a scenario. Now, you all know that at this point in National Council's NCLEX, scenarios aren't really provided for the student. But in the new model, there will be a scenario, and you'll see that in the questions that I'm going to share with you, so that the judgment that the student has to make is based on multiple factors. It includes factors like the cognitive operations, which is level 3, and the factoring conditioning, which is level 4, and the expected behaviors or actions or observable outcomes in those levels. So let's talk a minute about level 3. And level 3 is really, level 3 and 4 actually are the crux of the model. So with level 3, the student must recognize cues. They have to be able to assess. They have to be able to filter out information. What's important? What's not important? And then they analyze those and organize the information. How does the patient look? What are their needs? What are their problems? And then they have to prioritize and evaluate and rank the hypothesis. What is urgent? What do I need to do first? With Kaplan, we actually have a test for NCLEX studying, and it's called Who Do You See First?, which will really mirror this type of clinical judgment. Then the student or nurse must generate some solutions. They must identify some interventions and take actions and implement those interventions for the highest priorities. And then finally, they will evaluate the outcomes. They'll compare what they observed, what happened, to what did I expect to happen. Then level 4 layers on to level 3, and level 4 is the contextual layer. It contains the factors of performance. So there are 2 types of contextual factors. The individual factors, which here are blue, but not in the National Council model, I believe they're gray. And this allows then for the student to identify what's happening in the environment, in the patient observation. What are they seeing? And what's going on in the electronic health record? What do the medical records show them? And then, is there a time pressure? Does something need to be done stat? And then in analyzing those cues, the knowledge, the specialty, the experience are the important pieces of analyzing. They have to have a foundational knowledge in order to be able to analyze what's going on. And then in the priorities, they've got to be able to think about what resources do I have? What can I do to help take care of this patient, this client? And again, what is my time pressure? What's my time frame? Then in order to generate any of the solutions, the student or nurse needs to have the knowledge and skills. It also has some effect, the candidate's characteristics. Are they quick to respond? Are they slow to respond? What type of student are they? Are the tasks very complex? What type of cultural considerations are there? Because that really brings into another dimension of how to take care of our client. And then when it's time to take action, what is the knowledge and the skill that the nurse or the student possesses, and what have been their experience? Have they had a client with a similar diagnosis before? Do they recognize cues that they've seen before? Have they actually started an IV before? What is their experience? And then they evaluate the outcomes. And they evaluate that through patient observation, and perhaps even experience plays into that as well. So level 4 is that recognizing, analyzing, prioritizing, generating solutions, and evaluating outcomes with all of the knowledge and skills and experience that the students or nurses have. So I'm going to give you kind of an example, because all of this has been pretty abstract to this point. But if we had a pediatric client in the emergency department, and that's my background, the ER, the client and the parents present. So environmentally, recognizing the cues, I see that the parents are present, right? And when I observe that child, my observation cues tell me the child is 8 to 10 years old. I assess the child. They have dry mucous membranes. They're lethargic. Their extremities are cool. Their capillary refill is 3 to 4 seconds. And then I look at the electronic health record, and I'm able to determine that there's a history of diabetes. I look at the vital signs. I look at the low-grade temp. There's diarrhea. There's loss of appetite. And all of those are cues to what's going on, right? And as an experienced nurse, I'm going to be able to continue down this path of clinical judgment without too much trouble, because I've seen clients like this before. A student may have never seen that. So the student says, okay, now I've got to analyze these cues. So the student needs to think about dry mucous membranes, low-grade temp, diarrhea, diabetes symptoms. So they're going to analyze the cues. And then they're going to prioritize those. They're going to get the vital signs. They're going to find out that when they check the lab work, they're going to find out what the blood sugar is. And then they're going to generate solutions. What are they going to do, and what are they going to report? And perhaps they're going to set up an IV for this client because of the dehydration, and they know that this is an intervention to come. And then they're going to evaluate those outcomes. So after the interventions, after the child has gotten the IV fluids and has had some time to rest, the child is talking and smiling and sitting up. So my interventions have been effective. So you see where the clinical judgment, many steps to get to the outcome. And this is a visual of the National Council's clinical judgment task model. But what I really want to share with you here is how the Kaplan's decision tree is a framework that can be used in that clinical decision model. Because the Kaplan decision tree just folds right up into the clinical judgment model. We actually, step one is for the student to identify the topic of the question, which is about recognizing cues, analyzing cues, so that that student can form a hypothesis about what's going on with this client. And then the second step of the decision tree provides the student with the foundational knowledge of, is this an assessment or an implementation answer when I look at the answer choices? So that I can use the knowledge of the condition and decide, do I need to make a further assessment or do I need to do something after I've recognized these cues? And then when it comes to taking actions, in the decision tree, the student has to decide, does Maslow apply? What are the higher level priorities that I need to do for this client? And are the ABCs an important part of the answer choices? So steps 3 and 4 of the decision tree, does Maslow apply, and are the answers related to the ABCs? What actions do I need to take? And then the 5th step of the decision tree mirrors, again, the clinical judgment model to evaluate my outcomes. Have my outcomes been achieved? What do I need to do further? So the next thing I want to show you, if that's not enough, let's take a breath and let's look at some samples that the National Council provided to us at the meeting, and some of these are actually on their website. The sample questions are available if you go to ncsbn.org, and on the left-hand side of the website, there's a section called NCLEX. When you click on that section, you get a drop down, and there's a section called Next Gen. And in that section are videos and newsletters. So I would encourage you to go to that site and go ahead and sign up for the email, which will deliver these newsletters and videos to you. So when we look at the types of items that are available on NextGen NCLEX, we have our dreaded multiple select items. I call this the dreaded select all that apply. So one of the things that National Council also told us was that not all of the questions on the NCLEX will be next-gen questions. However, they didn't give us a percentage, but they indicated that there would still be some of our regular multiple choice questions, some of our regular select all that apply. But these are the newer types that I'm going to show you. They did indicate that there could actually be up to 10 choices in a select all that apply, and from 1 to 10 of those choices could be correct. So our options with next gen questions are multiple select, highlighting items, and I'm going to show you some items Kaplan has written and how they function. Right now I'll just zip on through what National Council has. Highlighting items, close examples, and close means like fill in the blank, and matrix items, which the student would have to tell you whether an action is indicated, non-essential, or contraindicated, and as well as drag and drop items. So let me go ahead and show you some of the items that our wonderful Kaplan curriculum team has developed. And I've got these in a functional prototype so that I can show you how they'll function. But the very first thing that you'll see is that there's a scenario. The nurse provides care for the client who's diagnosed with a brain tumor. The healthcare provider diagnoses the client with central diabetes insipidus. And it's showing me part of the medical record there. It shows me the vital signs. It shows me some of the lab work. And now it's asking me, which action does the nurse take? and it's a select all that apply. So the student would then read the question, analyze, recognizing the cues, and analyze the cues, and then answer the question to determine what actions they're going to take. Well, in this case, I want to infuse an IV. And I also want to obtain some serial urine specific gravity measurements, as well as administer some desmopressin, because it's a synthetic vasopressin, that's used for diabetes insipidus. And I need to assess the level of consciousness frequently for this client, because it'll help me determine the level of dehydration, the degree of dehydration. So the student then has to evaluate all of these answers with the data that they're given. Now, in a few minutes, we're going to talk about scoring, and that's going to be a real change in what we're doing now versus later for NCLEX. Another example of a next-gen item is the highlight item. And here again, there is a scenario, and the student is to read the following case study and refer to the case study to answer the questions. And the question says, which finding, plural or singular, requires follow-up by the nurse? And in this case, I'm going to bring that forward a little bit, a few of the boxes, so that you can read them better. And you'll see that the student can highlight any of the answers that they believe are important findings for this question. And if they change their mind, they can unhighlight it as well. But in this case, the vital signs for this client, current, 12 hours ago, and 24 hours ago, are significant. It's going to be really important for us as faculty to teach students about trends and patterns, and what is the data showing us? What are the cues that provide us with the information we need? So the respirations are significant. These are findings that I should follow up on as a nurse. And then I'll pull forward some more of the data. The red cell count, that is significant. The white count is not. The hemoglobin, the hematocrit, as well as the platelets are all significant findings. And the potassium. So the student really needs to know all of these normals and abnormal lab values. And then the albumin is also significant in this case. And we're still not through. We still need to figure out which findings require follow-up by the nurse. So we continue on, and we see that that now in the current time frame, asterixis or asterixis is present. That's the flapping, of the hands. Lung sounds have been diminished all along. The Glasgow Coma Scale has changed. And there we have all of the findings that the student should have highlighted. And then they come to a close item, which is a fill in the blank item. And here again, we have our scenario. The nurse provides care to a young adult client who reports polyuria, polydipsia, and nausea and vomiting. The client's blood glucose is 486, and blood pressure is 88/50. Now, I hope that my students pick up on that lab value and that blood pressure. And those are the cues they need to know. But what are they going to choose? Based on that client's condition, they're going to choose the most likely option for the missing information in the table. So they'll note that the healthcare provider's prescription, and note it's prescription instead of order. They'll note that they need a prescription for some type of medication. And they have to decide what that medication is, and it comes in a 0.1 unit, and it lowers the blood sugar. So they're going to look at their options in the drop down, and they're going to decide that they're going to give regular insulin infusion. And then they're going to see that they're going to give an IV, and they need to select the rate to increase intravascular volume. So over what period of time would they do that? Well, over an hour, they'd get a fluid load and increase intravascular volume. Then, looking at the urinalysis in the lab reports, I need to see what indication is meant there. And why would I do a urinalysis? I would do a urinalysis to verify ketonuria. And then I'm looking at a prescription for an IV for nausea and vomiting, a med for that. And I select the drug for that. You'll notice that they're generic. And then I want to look at a lab result, a medication that's given in milliequivalents. And that would be potassium. And then what about my IV fluids? I want to give 250 an hour when? And that would be after the blood glucose drops. The next type of item I think is a really interesting one and important one. And, I'll say here that, these are really hard questions. And students are really going to have to be prepared to think through all of the cues and what are they going to do about them. I feel good about the direction of our testing because I think it does look like the clinical judgment that we'll need in the hospital setting. And as I age, I certainly want these students to be prepared to care for me. So here's another example, and this is the matrix item. And in this matrix item, it shows the progress notes. It tells me what's going on with this client. And it asks me then to decide which action should the nurse prepare to take. So would the nurse ask the client to rate their pain if this is a client who has come in with an acute myocardial infarction and we have the progress notes? So is it indicated, non-essential, or contraindicated to ask the client about their pain? It is indicated. What about obtaining baseline levels of the cholesterol, HDL, and LDL? Is that indicated? Well, it's not essential because he's already having his MI. I hope we had treated that prior to now. What about administering metoprolol? Is that indicated or not indicated? It's actually contraindicated in this case. What about preparing the client for percutaneous coronary intervention and thrombolytic medication? Not indicated, it's contraindicated. But then what about administering aspirin? Yes, it is indicated. And then we should determine if the client smokes cigarettes, and if so, how many cigarettes per day. Is that an important factor? Not essential at this point. And then finally, we have the drag and drop. And you'll notice that we only use 5 of the potential actions to take. From the box on the left, the student will drag the best initial nursing action for the selected condition to the box on the right. And they will select, they will have some left over. They can change their answers as long as they have not moved on to the next item in the test. So once that is done, then they can move on. So let me say a little bit about scoring methods. So right now, students either get the answer correct or incorrect. And so that way it's a dichotomous, it's correct or not. You'll see that in the third column there. The answer to this question, the correct answers are B, C, and D. So if the student got it correct, they would get 3 whatever, 3 points, 3 whatever. We don't know what they'll be called. But if the student only selected B and C, they would get only 2 points or 2 measures, whatever. If they selected, like in number 3, B, C, and F, which is incorrect, they would get a 2 minus 1 equals 1 point or measure. So there's many combinations of the student's score here. It does penalize the student if they are using the strategy or the thought that they're just going to select them all. Because if they select them all, then there will be some points subtracted from this scoring method. So I'd like to have everybody take a big deep breath and relax a little bit. And I want to tell you about one other thing that we're doing to help students with clinical judgment. And that's with our iHuman Patients, which is a virtual simulation product that we are currently developing. And within this virtual simulation, we're basing it and building it on the clinical judgment model so that the students can take a case, a scenario, they can review the electronic health record, they can recognize cues from the health record, from a physical assessment, from interviewing the client, and they can determine what are the priorities or key findings, recognizing those cues, and then analyzing those cues and moving forward through the case to take action and then evaluate how their actions affect that client in that case. So that as students will be in those cases, they can take next generation test items of the future in those cases. We are building those into it over a period of time. We'll have simple to complex cases, and we will also have all specialties. So you'll have an opportunity to evaluate, look at our demo of iHuman Patients in the future. If you're interested, please let us know. There's a way for us to share a demo with you virtually. And building on, again, the clinical judgment model so that all students would have the opportunity to look at those scenarios and move through clinical judgment. So that's all of the material I have prepared for you. We are planning to have a couple of more webinars. One, I know we'll start talking about how do you write next gen NCLEX questions. Even more information as we progress through the year on gathering information from National Council. How can we help you write those, and what else are we doing in Kaplan to be prepared for the next generation NCLEX.